You got the blood test back. Maybe your doctor called, or maybe you saw the result online before anyone explained it to you. And there it was, a number flagged in red. Creatinine, elevated. And somewhere underneath that clinical word was a quiet, creeping fear you haven't fully been able to shake since. Maybe you've been searching at night, typing things into Google at 2 a.m. that you're afraid to say out loud. Maybe you've already gone down rabbit holes that left you more frightened than when you started. Or maybe you've done the opposite. You tucked the paperwork somewhere and decided not to think about it too hard, hoping the next test somehow comes back different. I want to talk to you directly, as a person who has spent years working with older adults facing exactly this moment. Because what happens in the days and weeks after a high creatinine result, what you decide to do, what you choose to eat, how you move, what questions you ask your doctor, that window matters more than most people realize. Not in a frightening way, in a genuinely hopeful one. Because here is what almost nobody tells you when they hand you that piece of paper. For most people in the early and moderate stages, elevated creatinine is not a verdict. It is a signal. And signals, unlike verdicts, can be responded to. Today, I'm going to walk you through 5 specific, evidence-grounded actions you can begin today. Not next month, not after your next appointment, today. That research consistently shows can support kidney function, reduce the burden on those overworked filtering organs, and in many cases meaningfully improve the numbers over time. These aren't vague lifestyle suggestions. They're targeted, biological, and they work together in ways that compound their individual effects. But first, let's make sure we actually understand what we're dealing with. Because the word creatinine gets thrown around a lot, and most people leave the doctor's office without a clear picture of what it actually means for their body. Your muscles are working right now. Even sitting still, even breathing, there's continuous low-level muscle activity happening throughout your body. And every time muscle tissue contracts, it breaks down a compound called creatine for energy. That breakdown produces a waste product, creatinine, which gets released into the bloodstream constantly, day and night, without pause. Under normal circumstances, your kidneys catch this waste. They filter it out of the blood and excrete it in the urine with remarkable efficiency. The result is that blood creatinine levels stay within a fairly predictable range, roughly 0.7 to 1.2 milligrams per deciliter for men and 0.5 to 1.0 for women, though labs vary slightly. When creatinine levels climb above that range, it signals something specific. The kidneys are no longer filtering as efficiently as they should. Their filtration capacity, what physicians measure as the glomerular filtration rate, or GFR, has diminished. The higher the creatinine and the lower the GFR, the more the kidneys are struggling to keep up with the work they're designed to do. Now, why does this happen? In adults over 60, there are several overlapping reasons, and understanding them isn't just academic. It directly informs which of the 5 actions matters most for you personally. The natural aging process plays a role. Kidney filtration capacity declines gradually from around age 40, at roughly 1% per year. By the time many people reach their 70s, they may have lost a quarter or more of their peak filtering ability. This isn't disease in itself, but it narrows the margin considerably, meaning that other stressors that a younger person's kidneys might easily absorb become much more significant. Chronically high blood pressure is one of the most destructive forces on kidney tissue. The kidneys are threaded with extraordinarily delicate capillaries called glomeruli, tiny filtering structures that are exquisitely sensitive to sustained pressure. Years of uncontrolled hypertension stiffens and damages these vessels, gradually destroying the very architecture responsible for filtration. Here's what makes this especially insidious. Kidney disease itself raises blood pressure, creating a cycle that each condition perpetuates in the other. Chronically elevated blood sugar, whether from diagnosed diabetes or the quietly dangerous state of prediabetes, causes a different kind of destruction. Glucose molecules bind to proteins in the walls of blood vessels in a process called glycation, stiffening and damaging the glomerular capillaries over time. This happens silently across years, long before any formal diagnosis is made. Research shows that kidney function markers can already be deteriorating during the pre-diabetes phase, which affects an enormous proportion of adults over 60. Dehydration is far more common in older adults than most people appreciate, and its connection to elevated creatinine is direct and often underestimated. When the body is dehydrated, blood becomes more concentrated and blood flow to the kidneys decreases. Creatinine, which requires adequate urine output to be excreted, begins to accumulate. In many cases, what appears on paper as worsening kidney disease has a significant component of chronic mild dehydration driving it. And finally, certain medications, both prescription and over-the-counter, place direct stress on kidney tissue. Some are nephrotoxic by chemistry, others interfere with the kidney's ability to regulate its own blood supply. This is a category worth paying very close attention to, and we'll come back to it in detail. Here is what I want you to hold on to before we go any further. Chronic kidney disease progresses through stages. In the early stages, when creatinine is mildly to moderately elevated and GFR is still relatively preserved, the kidneys retain significant responsiveness to lifestyle and dietary interventions. The actions we're about to discuss are most powerful at this stage. In later stages, when substantial nephron loss has already occurred, the picture becomes more complicated and the focus shifts toward managing complications rather than reversing course. Most people watching this are in the early or moderate range, and that means the window of greatest opportunity is right now. Not alarming, actionable. The first and fastest action you can take, the one that can show measurable results in days rather than weeks, is deliberate, consistent, scheduled hydration. The kidneys filter blood. To filter blood, they require adequate blood flow, and blood volume is directly tied to how hydrated you are. When you're even mildly dehydrated, blood becomes more viscous. Pressure in the kidneys' microvasculature shifts, and the kidneys receive less of the steady flow they need to work efficiently. Creatinine accumulates because there simply isn't enough urine volume to carry it out. Here's what makes this especially tricky in older adults. The thirst mechanism becomes significantly less sensitive with age. A young person typically feels thirsty after losing about 1 to 2% of body water. An older adult may lose 3 to 4% before feeling any urge to drink. By the time thirst registers, meaningful dehydration has already set in. Add to this the fact that many older adults deliberately restrict fluids to avoid frequent bathroom trips, and you have a population that is chronically underhydrated in ways that continuously and silently stress the kidneys. The solution isn't to drink when you feel like it. The solution is to drink on a schedule. 6 to 8 glasses of plain water per day is a reasonable starting point for most people with mildly to moderately elevated creatinine and normal urine output, adjusted for body size, climate, and any physician-imposed fluid restrictions. Herbal teas, particularly dandelion root and nettle, have mild supportive properties in the research literature and contribute meaningfully to daily fluid intake. Water-rich foods, cucumbers, celery, watermelon, zucchini, add hydration alongside valuable nutrients. Set a reminder on your phone every 2 hours from the time you wake until early evening. Fill a measured bottle each morning and make finishing it non-negotiable. Track. Urine color. Pale yellow means you're well hydrated. Dark amber means you need significantly more water. This single habit, implemented consistently, can change your creatinine numbers within weeks, and in some cases faster. The dietary approach that best protects both blood sugar and kidney function rests on 3 principles that work synergistically. First, replacing refined carbohydrates with fiber-rich alternatives, vegetables, legumes, whole grains, and low-sugar fruits. Rather than white bread, white rice, pastries, and sweetened cereals. Fiber slows glucose absorption, reducing the height and duration of the blood sugar spikes that drive glycation and oxidative stress on kidney tissue. Second, distributing carbohydrate intake across smaller, more evenly spaced meals rather than large concentrated loads, which minimizes the peaks that do the most damage. Third, incorporating gentle movement after meals. Even a 15-minute walk following your largest meal has been shown in multiple studies to meaningfully reduce post-meal blood glucose because muscles actively take up glucose during movement, reducing both the concentration and the duration of elevated blood sugar. If you haven't had your HbA1c checked recently, ask for it at your next appointment. It's a simple blood marker that reflects average blood sugar over the previous 3 months and can reveal whether prediabetes is contributing to your kidney picture in ways that no one has yet addressed. The 5th action is the one most people consistently overlook, and it begins not with a food or a habit, but with a list and a conversation. The kidneys are the primary route of excretion for a large number of medications. When kidney function is reduced, drugs that are normally cleared efficiently can accumulate to higher concentrations than intended, sometimes reaching levels that cause direct toxicity to the very tissue responsible for clearing them. At the same time, certain medications place a direct chemical burden on kidney cells regardless of accumulation, triggering oxidative stress and inflammation in renal tissue. The most commonly encountered kidney-stressing medications in older adults are non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, diclofenac, and related compounds that are available over the counter and widely used for pain, inflammation, and fever without much thought. What most people don't know is that NSAIDs reduce the production of prostaglandins, compounds the kidneys use to regulate their own blood supply. Without adequate prostaglandins, blood flow through the kidney's filtering structures drops, particularly in people who are already dehydrated or have reduced baseline function. For someone with elevated creatinine, regular NSAID use can cause rapid and significant worsening of kidney function. The alternative conversation with your physician should include whether acetaminophen at appropriate doses or other non-nephrotoxic options can manage your pain and inflammation needs more safely. Beyond NSAIDs, the review should cover certain classes of antibiotics that require dose adjustment and reduced kidney function, contrast agents used in imaging scans, your creatinine level needs to be known before these are administered, and every supplement, herbal product, and traditional remedy you are taking. This last category catches many people off guard, but numerous herbal preparations, including certain Ayurvedic formulations, high-dose vitamin C supplementation, and products containing chromium or germocranium, have documented nephrotoxic effects. Your doctor can only protect you from risks they know about. Make a complete written list. Every prescription medication, every over-the-counter drug, every supplement, vitamin, herbal product, and remedy with dose and frequency. Bring this to your next appointment and ask specifically, given my current creatinine level and kidney function, are any of these placing additional stress on my kidneys? That single conversation could be one of the most impactful you have this year. These 5 actions are not isolated interventions. They address 5 distinct pathways of kidney damage: blood flow, waste load, vessel pressure, microvascular, integrity, and chemical burden. And when 2 or 3 or more are implemented simultaneously, their effects genuinely compound one another. Better hydration and lower blood pressure together deliver more oxygen to kidney tissue. Reduced protein waste and improved hydration together enhance the kidney's ability to clear what remains. Stable blood sugar and lower sodium together reduce the inflammatory burden on glomerular cells. The biology is synergistic in the most practical sense. The combined impact of multiple protective changes is meaningfully greater than any single change alone. This is why I encourage people not to treat this as a menu where you pick one item. Start with whichever feels most actionable for you today. Hydration is the easiest entry point for most people, and layer the others in as quickly as you practically can. In terms of eating, the framework is simpler than it might seem. Prioritize vegetables of all kinds: leafy greens, cauliflower, broccoli, cabbage, green beans, bell peppers, along with lower potassium fruits like apples, berries, pears, and grapes. Lean into plant-based proteins: lentils, chickpeas, tofu, tempeh, egg whites. Choose fish and poultry over red meat. Use olive oil, avocado, and a small handful of walnuts for healthy fats. Build meals from whole grains in modest portions: brown rice, oats, barley. And significantly reduce or eliminate red meat, processed meats, canned foods with high sodium, sugary foods and beverages, and alcohol, which is dehydrating, metabolically costly, and interacts with many medications. A touchstone worth remembering: if it grew in the ground or swam in clean water, it is almost certainly working with your kidneys. If it came in a packet, a tin, or a fast food wrapper, it is almost certainly working against them. Alongside these 5 actions, request regular follow-up testing so you can track the trajectory of your kidney function over time. The key markers worth following with your physician are serum creatinine and the calculated eGFR, the urine albumin 2, creatinine ratio, which detects protein leaking into urine as an early and sensitive marker of glomerular damage, blood pressure at every visit, HbA1c if diabetes or prediabetes is part of your picture, and electrolytes including potassium and phosphorus, which can become disrupted as kidney disease advances. Progress. You can measure is progress you will sustain. Watching these numbers shift in response to changes you deliberately made is not just clinically meaningful. It is deeply motivating in a way that abstract advice never is. And work with your medical team, not around them. If your eGFR has dropped below 60 and you have not yet been referred to a nephrologist, a kidney specialist, it is entirely reasonable to ask your primary care physician whether a nephrology consultation would be appropriate. Many referrals happen later than optimal. You are allowed to ask. Similarly, a renal dietitian is a specialist whose value is consistently underutilized. The dietary management of kidney disease is genuinely complex. The right targets for protein, potassium, phosphorus, and fluid vary significantly depending on your stage, your other conditions, and your individual nutritional status. A renal dietitian can create a plan specific to your numbers and your actual life, not a generic template pulled from a pamphlet. I want to close with something I believe with real conviction, drawn from years of working with people navigating exactly this kind of moment. There are 2 versions of what happens after a high creatinine result. In the first version, you feel the weight of the number, you feel the fear, and then you put the paperwork away and hope. You tell yourself you'll deal with it after the next test. And the next test comes back, and the number has moved, but not in the direction you were hoping. In the second version, you feel the weight of the number, you feel the fear, and then you decide, quietly and deliberately with clear eyes, that you're going to do something about it. You drink more water today. You check the sodium on the label of something you were about to buy. You replace tonight's red meat with lentils or fish. You take a short walk after dinner. You start the list of everything you're taking so you're ready for that conversation with your doctor. You treat your kidneys with the same attentiveness and care that they have given your body, silently and without complaint, every single day of your life. The kidneys are remarkable organs. They have real reserve capacity. In the early and moderate stages of dysfunction, They respond meaningfully to the right conditions. And the 5 actions we've covered today, hydration, protein reduction, sodium control, blood sugar management, and medication review, are precisely those conditions. They are not dramatic. They are not expensive or complicated or reserved for people with exceptional willpower, but they are exactly right. And consistency with the right conditions over weeks and months genuinely changes the story. You are not a bystander in any of this. You are the most important participant in your own kidney health. And you now have a clear, specific, actionable plan for what to do next. Start today. Not tomorrow, not after the next blood test. Today, with a glass of water, a label you actually read, and the steady, calm decision that your kidneys deserve better than they've been getting.